Hi, my name is Amy Killen, and I have a Body Logic MD practice in Portland, Oregon, where we do bioidentical hormones, personalized nutrition, and fitness. I went to medical school in Dallas at UT Southwestern, and then I went to University of Arizona for my emergency medicine residency after that. And I worked for 7 years in the emergency department before transitioning into anti-aging medicine. You know, I liked the ER a lot, and it was very rewarding, but I started seeing a lot of patients that had chronic illnesses and things that I felt like I wasn't really helping very much. They would come in and I kind of just, sort of tune them up and then send them on their way. I wasn't really helping them very much, and so I started learning a little bit more about some things that I could do to actually help them, and that led me to the fellowship, and that's kind of what got me started. Patients that come to see me are generally men and women who are about mid-30s to maybe mid-50s, coming in with symptoms related to menopause, perimenopause, thyroid problems, andropause, cortisol problems, basically hormone imbalances making them feel like they're not feeling as good as they want to feel. And so they come to see me in hopes that I can help them feel better and sort of gain their vitality and gain their life back. So my approach is that I sit down and talk to them, and we have a very long conversation. It's an hour, which is a big luxury in the medical system today, and talk about sort of what's going on with them. And then we'll focus on a few different things. The hormones are a very important piece of the puzzle, so we work on balancing the hormones. So we also want to work on nutrition, and we work on fitness. And then we also look at other parts of the puzzle. We look at inflammation and making sure that we decrease chronic inflammation in hopes of preventing a lot of the diseases that can be prevented. So we look at the gut, we look at toxins, we look at stress and stress management and how patients deal with their stress and their cortisol levels. So it's actually a very multifaceted approach to health. A lot of our patients have problems with their weight. They've been gaining weight and can't lose weight, and they've tried every diet. And we teach them that it's not just about the number of calories you're eating, it's about what types of foods you're eating, it's about your insulin response to the foods, it's about how much protein and what kind of protein and what kind of toxins. And then of course the hormones play a big part in that as well. Your cortisol affects your weight, and your other hormones, your estrogen and testosterone and progesterone can all affect your weight. So getting all of those things balanced, as well as adjusting what you're eating, can make a big influence and make people feel much better and lose weight for the first time when they haven't been losing weight in a while.
I have a 6-year-old at home, and when I started the search, she was about 3, so I would go to doctors and just tell them I had no energy, and that, well, you're a mother of a 3-year-old. Of course you don't have energy, but it was something deeper than that. I was so tired, and my hair was falling out. I just did not feel myself, and I'm usually a very energetic person. I always was my whole life. I went through several doctors actually, and each one of them would tell me that normal range. They checked my thyroid, they checked basic blood work, like blood count and certain things, and they said, oh well, you need to find ways to relieve stress, do yoga, different things like that, and nothing worked. And I saw the Oprah show with the Body Logic and the bioidentical hormones. I just saw it, and something clicked, and I said, I'm going to try it, and I'm so glad I did. So I started on progesterone, felt a little better, but as I now know with the whole bioidentical, it's a symphony. So with the progesterone and the thyroid, now myself. Yeah, so now I think I've been on my thyroid medicine 6 months, and sleeping, happy, playing with my child at the park, going down the slide, chasing her, going to the beach. I'm back to myself.
So this type of medicine is basically about preventing illnesses as much as possible. Before they become chronic illnesses and before they become really severe, we want to get a head start on preventing them. So if you'd like some more information about my practice, you can go to bodylogicmd.com and search by state, and I'm in Portland, Oregon, and I'd be happy to give you some more information.